resilient. So tonight, I think Alex already posted the ground rules. So I just want to make a land acknowledgement before we start the forum. We acknowledge that Asian Community Aid Services have the privilege to work in this sacred land for many homes and hunting grounds to the indigenous people for 1,000 years, which including the Mississauga credits of the river, Anishinaabe, Ojibwe, and Haudenosaunee, and Wendat people. The meeting place of Toronto is the many home for the First Nations, Inuit, and Métis people across the Turtle Island. We acknowledge and grateful to have the opportunity to live and work in this land. Tonight, we have very amazing panelists as well as our moderator, Ben Chen. Ben consider himself is an Asian HIV gay boy. He identified himself as a cisgender gay boy. He came to Canada over 20 years ago, but many years he's been being bullied and discriminated while he trying to find his acceptance and identities. Ben cannot wait to the pandemic is going to be over so he can meet some of his friends back and hit on some hot men. So without any further ado, I pass on the screen to Ben, our gay boy moderator. Welcome, Ben.
Hello. So everyone, good afternoon or good evening. Okay, so so tonight our the forum it is to strengthen our community in this pandemic. So I first will start with introducing 3 activists and also advocates that has who are part of ACAS, and so maybe perhaps we'll find like some similarities with you. But before we start, we are going to play a game. So I will ask a question about what each of the activists that we're going to be introducing, and anyone who answered the question correctly would get a gift from ACAS, and Alex would contact you afterwards by email, I was told. So the first one we're going to talk about is Dr. Kirby Zhu. So if you know of him, there is a support service provided by ACAS named after Dr. Zhu. So what is this service? So is it like a raise hand thing, or I don't know. So Alex, so what should I do with this? Anyone?
So if you know the answer, you can raise your hand, or you can
just unmute
yourself and answer.
And you get a gift. So let me repeat. So it is Dr. Kirby Zhu, and there's a support service provided by ACAS, and it's named after Dr. Zhu. Okay. 5, 4, 3, 2, 1. Okay.
Can I give a hint to folks?
So okay, so sure.
So it has to do with money. What do you see Alex for money about? No guess.
Yeah.
Okay, no problem.
Okay. Someone raised a hand.
Who?
Sorry, I'm just going to take a guess just to get the game going. ACAS Financial Assistance?
That's correct. So the name is actually Dr. Kirby Chu Emergency Fund. Am I correct, right? So yes, so yes, this fund was created and it was named in honor of Dr. Kirby Chu. So Alex, you have the name?
Yep, I got the name.
Okay. All right. So the second person, it is Nito Marquez, Marquez. So Nito Marquez. And so the question is, in which organization did Nito work as an intake worker and case manager? Lee?
Sorry, is my microphone on? Can you guys hear me?
Yes.
Nito was the case manager at the Toronto People with AIDS Foundation, PWA.
That's correct. Oh, hey, okay. So the third person on the list is Patrick Trung. And the question is, what is the last support group Patrick founded in ACAS before he passed away?
Anyone?
Anyone? That's a surprise, right? Because I saw them like in their support group like a few days ago. So again, the question is, what's the name of the support group, or what's the last support group that Patrick found in ACAS before he passed away?
I believe it was the youth group.
Youth group?
Yes.
No. So you owe me a gift.
Someone in the chat said women's program.
It's not correct either.
And we have an answer, Alpha by Andrew.
Oh, Andrew, you're correct. No surprise. Okay, so Andrew got a gift from Alex. Okay, so yeah, so so we have I mean the three people we're going to be talking about would be, or introducing would be Dr. Kirby Chu, and Nito Marquez, and also Patrick Trunk, and they had a lot to do with ACAS. And so we can move on to the slides. Now, so for Dr. Kirby Chu, and he was from Hong Kong, and his profession was a psychiatrist. So he became HIV positive in the 1980s, around the time of the GAAP and GAT, which is Gay Asian AIDS Project and Gay Asian Toronto. And he was pretty open about his gay and HIV status. After he became HIV positive, he put a lot of time in running a support group in GAAP, and he was highly involved in merging GAAP, GAT, and a few other Asian agencies into ACAS. And during this process, he laid down very clear mandates for ACAS to provide services which are supportive, according to him, supportive, protective, and meaningful. And Nito Marquez, and he was from the Philippines, and he co-founded the Gay Asian Toronto in the 1980s. After his diagnosis with HIV, he went to ACAS for support, and then he joined the ACAS board of directors for a few years. He later joined PWA in the field for a few different roles, and shared his stories publicly that touched many in the community. And the last person is Patrick Trunk, and Patrick is was from Vietnam, and he came to Canada in 1970s, and he came out in the 1980s during the AIDS crisis. He was an activist on HIV stigma, discrimination, and homophobia, and he was the president of Gay Asian Toronto. And besides ACAS, he also served in groups like CATTSN, Club 25, ASAP. And in ACAS, he started support services for HIV positive women. He started the PHA mentorship program and also the Alpha support program. And in 2010, he received the Ontario AIDS Network's Caregiver Award. So this is the introduction of the three people, and I hope you'll find some similarities with you. And now it comes to our three panelists. So the three panelists, so we're going to introduce them to you, and then we'll ask them a few questions, and they'll be taking turn in voicing their whatever they would answer. So the first panelist is Christian, and Christian his pronoun is he and they, is a queer Asian settler originating from Hong Kong and has lived with HIV since 2003 at the age of 25. So for a decade, he was an ACAS staff member holding various roles, including being in the community engagement and Ontario Positive Asians coordinator, and has fundraised for the agency annually at the Scotiabank Toronto Waterfront Marathon, Half Marathon, and 5K Charity Challenge. As a community activist, he has supported the Undetectable Equals Untransmissible, U equals U campaign, and he is an advocate of the greater involvement, meaningful and engagement of people living with HIV/AIDS, which is GPA-MIPA, harm reduction, and health equity. He was awarded the Ontario AIDS Network Person Living with HIV/AIDS Award in 2017 and the Pause Toronto Award in 2018. And our second panelist is Fandi. Fandi is a 41-year-old Indonesian Muslim who identifies himself as a gay man. Him, man. He came to Canada 9 years ago in July 2012 as a temporary worker. He was on a work contract for 2 years in a farm in Leamington, Ontario, which is 3 to 4 hours from Toronto. He has a college degree in health, safety, and environment from University Indonesia. And our last panelist is Nancy. Nancy was born and raised in Korea, and the preferred pronoun is they. Nancy came to Canada as a refugee over 8 years ago and now is a permanent resident. Nancy is a community member of many agencies, including ACAS. Hobbies are food and acting. Nancy loves to laugh, and Nancy believes laughing is the best remedy to heal. So now we have a few questions for our panelists. So I'll say the question and then I'll invite a panelist to answer. Now, so the first question is, what does living with HIV as an Asian mean to you? And how did you become connected with ACAS? So would it be a Christian first or? Okay, let's go Christian first.
Or others can go first. First of all, thank you so much for inviting me. It's such an honor and privilege to be here. It's lovely to see so many of you, and I am so excited to be on the panel with Fandi and Nancy. It's a true honor. So maybe I'll just go first for this question, but hopefully, you know, we can just rotate. Just a little shy here. So what does it mean to live as an Asian with HIV? Well, first of all, I think as being a part of an amazing community of Asians living with HIV, which I, you know, just feel so lucky and grateful to be a part of. And it means being an Asian living in HIV, through the years, I've learned that it means being proud of who I am, both for my heritage as a person born in Hong Kong, but more importantly, as a queer settler and as a person living in HIV. I'm someone, you know, I've learned that I can utilize my own living experiences to support my peers and also to contribute to the local and global HIV/AIDS response. So I actually connected to ACAS back in 2011, and thank you, Ben, for providing such a great, fun game. I think, you know, the questions were a little hard, but you know, it provided us a great background of how ACAS came together. While I did not know Dr. Su, we both shared the same last name, actually. And then coincidentally, Nito was my caseworker at PWA when I, you know, first got diagnosed at the age of 25. And later on, I actually got connected with ACAS around 2011, during the year when I was completing a year of interferon treatment for my hepatitis C, which I had contracted from injection drug use. So what I thought about ACAS was that immediately I was struck by how comfortable I felt being in this small yet really supportive and caring community. And I volunteered and became a support program mentee with the late Patrick Trong, who was the ACAS support program coordinator then. So all in all, I would say ACAS has been the agency that's provided me a home away from home and opportunities for me to learn ways to support my fellow queers and POS Asians through various roles. So that's my maybe not very short answer to your question.
Okay, thank you, Christian. Sorry. So next, I have Fandy.
Okay, thank you for the asking. Hello, everyone. To be honest, I'm a little nervous now. I hope you all understand what I say. If not understand, you can asking back to me. For me, because I come from the Muslim country, it's very difficult for living with HIV or homophobia over there a lot. Because I come the rule Muslim very difficult for the open. Until now, I can talk with my family what happened with me. I still secret with them, but in here I tried for the disclosure because I little confident in here. In September 2013, when I was live in Canada, I have a hospital rise. I very sick. And then I meet ACAS over there from the north because they identify me from the Asian. And then they tried for the looking connection with organization, make easy for the me communication or get the support. Before I go back to the working in the Leamington, ACAS tried for the send me to what the name Casey House for the get treatment before I go to work for the adaptation with the another people, because in a farm I still secret what happened with me because almost 6 months and that I very sick in here. Very secret. I take medication too over there. Very, very secret because they mostly my coworker over there is men all and then straight all. Maybe only me, the gay people of worker over there. Yeah. Before I finish my work permit, I tried for the connect again with the ACAS for the looking what happened with my status now because I decide I cannot back to my country because I can die. I say like that because danger for my life. And then ACAS support me like apply my refugee, apply my permanent resident, and then until I got my citizen. Then yeah, a lot the ACAS support me. Thank you for ACAS.
Thank you, Bandy.
Thank you.
So the next person is Nancy.
Hi.
Hi.
Hi, everyone. My name is Nancy, and my gender pronoun is they, them, and then I'm a gender fluid. I came to Canada in 2013, and then I claimed the refugee at the airport because they won't let me in because I had a bad infection on my face, and then someone, I mean, they thought I was crazy, which is, I mean, true because I have schizophrenia, but they were, I was gonna get into Canada and then find someone to marry and then get a residency, but then they were, it was murky, and then I was sent to the detention center, and then the last day I was going to deported. They arranged meeting with some officer, and then he asked me if I'm here to claim refugee. So I said yes. I thought it was the opportunity, and then I came here. I was sent to the shelter, Seton House, but I had a fever, and then I had a infection on my face, so they sent me to the St. Michael's Hospital to check it up if that thing is contagious or something. And then I was diagnosed AIDS in that hospital, and then there was a McQueen House worker in and out of the hospital, so they introduced me to the McQueen House worker, and then the McQueen House worker sent me to ACAS. So I got the membership in ACAS, and then living with the HIV as an Asian means, I mean, Asians are shy, you know. we all kind of hiding. We like to, we are uncomfortable when we have to show ourselves. So I mean, that's kind of a difficult to living with the. I mean, I was asked to become boyfriend a couple of times, and then I told them I have HIV, and then they rejected me. So I'm more concerned about the situation, and then that happened again and again. So that's kind of a problem living as an Asian HIV positive, and everybody's hiding. So I mean, if that's like Asian culture, we don't show everything. So I think that's the most difficult thing to live, because we have to hide. Yeah.
Yeah, but this is more like by yourself, right? But we do have a community. So let's go to the next question.
Yeah.
So let's refer our community as the Asian person living with HIV or AIDS community. So the question is, how are you connected or engaged with your community?
Oh,
And also, what does advocacy and activism mean to you? So you can go first, Nancy.
yeah. I mean, I I learned a lot from workshop from ACAS and then ACT, and then yeah, they provide the monthly workshop from ACT, and then I mean the ACAS offered like 4 times a year, and I really enjoyed it. I learned a lot because before I learned these kind of things, I thought the AIDS will die. You know, people if they have AIDS will die, and then I learned a lot from the workshop that it's not true anymore. So we can live like a normal person, and then I mean some people even get children. You know, the father is HIV positive, and then mother is HIV negative, and then the children are HIV negative too. So that kind of thing, they kind of things educate me a lot, and then so I feel like I have a second life, you know, more hope for the normal life, the second chance of life.
Mhm.
And yeah, so I mean, I try to go to the workshop more, and then I was volunteer for the food bank, FWA, for a while, and then yeah, I mean
Also helping others, right?
that kind of thing
Mhm.
is really important, I think.
So thank you, Nancy. So next, let's go back to Christian.
Thanks, Nancy. Thanks, Fendi. Sorry, I'm going before you, Fendi. Next time you go before me. So my community, how am I connected or engaged with my community? Well, I think I would say I was quite much more engaged with my Asian pause community before I went back to school this past September. And as Ben introduced, you know, during the intro, I worked at ACAS for almost a decade. So that was the time when I really, you know, got the opportunity to learn about how to support, you know, fellow pause members or queer community members who, you know, often have to, you know, are unable to disclose their status. And as Nancy had mentioned, I think I always feel most at home when I'm with the pause community. And that's because I live with HIV. This is especially true when I'm within the pause Asian spaces. So such as events like this, I just really feel at home. And I actually do very much miss, you know, part of me miss working at ACAS. I would say, you know, within the broader pause community, you know, we don't necessarily always have to hide our status, and we can just be open with who we are. But yet, I think having a culturally safe environment for us as Asians is very important. And as Nancy had mentioned, you know, a lot of times, you know, we may not always be able to talk or share openly about, you know, what's happening in our lives out in the open, but amongst ourselves, we can do that. And I like how we have all become a family with one another. For me, advocacy and activism means honoring our own lived and living experiences and working towards something for the betterment of the community as a whole. So for example, with my experience with substance use and living with HIV, I shared my story when ACAS launched its online zine, Chi Magazine. Some of you may remember Meza, who was the social media coordinator at ACAS. He was, this really ingenious, very talented staff who was, launching a lot of different initiatives at ACAS. And he approached me and he said, Christian, are you willing to, write a blog article for us? And I said, okay. And then I really thought of what am I going to write? And, that was actually the decision for me to share my status online. And it was pretty nerve-wracking because, within the community space, within our own community space, I didn't need to hide my status, but I wasn't really sure whether I wanted to share my HIV status online. Yet anyway, I did some thinking. I thought, okay, I'm going to just write. And I decided, okay, I'm going to share my experience. That was something that I never regretted because since doing that, I've heard from other POS Asians who have reached out and said, thank you so much for sharing your story. Because of your story, I don't feel as alone. And these could be folks from, locally here in Toronto or other Asians from, global spaces in different parts of the world. So I think part of the reason why, I've decided to share my story about, being someone living in HIV or someone who has experience of substance use is because it often creates this opportunity to connect with one another. So I think this is really what, to me, activism means. So yeah, by doing so, I feel others can feel less alone, and in turn, I feel less alone. So it's a win-win situation.
Thanks, Christian. And I've seen you around at the press a lot. Okay, thank you. And next, please, Fendi.
Okay, thank you for asking. For me, advocacy and then activist is my superhero because they are long time ago they tried for the fight with the people, how to the people living HIV not very danger, and they fight to government how to get the human right for the people living HIV. How do I connect with the community? I tried for the join too many community in here for the make me confident and then make more friends and then more education. Like I joined in the PWA, I joined in the food bank, essential market, and then I joined to 5 hosts for the support people living over there in the breakfast club. And then I tried join to the Casey house in the program harm reduction kit. We are there, they not only packing the stuff, but we are sharing and then get a new information. And then I tried join to 519 too, like in the beginning, I get my support letter about refugee. I joined in the 519 in the program among for the people new come here. And then I tried for the join in the Act 2. Many organizations under the umbrella about the people living HIV. I tried join, but I tried for the confident. I wanna go outside the confirm for me. Like I joined to in the public community. I joined in the community St. James Community Center because I like to play badminton, and then I wanna show to people, the people living HIV, not weak, not very weak about the body. I can running, I can move, and yeah, I doing well, play badminton, and then I tried join Ines, and then I tried join to Regent Park, and then I get many friends, but I still secret. But step by step, I tried for the disclosure. Like if I online, yeah, to be honest, I looking for the facts. I tried online. In the beginning, I tried for this disclosure. Many people reject me, make me down. But after I get a workshop about you equal you, and then I tried for the campaign myself in the online, and then the people accepted the first sex with me because they little know about the you equal you. Yeah, make me more confident to for the speak out than for disclosure to anybody. Before I sex, I don't need. I get the criminal about the sex because before very scary for me. But now I confident. You equal you, go equal you. Thank you.
Thank you, Fandy. Now, so we heard like there's a lot going on in our community. And so the next question is like, what inspires you about our community? And how can we strengthen our community? And let's go to Christian again.
Okay, so thanks, and thanks, Fendi. I was really inspired by the vision and leadership and engagement that I was able to receive from other Asian peers whom I was working with to support the creation of Ontario Positive Asians, and also known as OPA, which is an independent grassroots network for and by Asians living with HIV. And it is an initiative that was supported both by ACAS and ASAP. And what is so inspiring about this was that the work of OPA was really guided through an advisory of PAUSE Asians, and it provided a peer-based and peer-supported space for PAUSE Asians, which addressed some of the topics that are important to us, such as learning about the diverse cultures of our community through the intercultural exchange series, or most recently, earlier this year, a workshop that involved a segment on harm reduction for Asians living with HIV. Another thing that really inspired me about my community, and I think Fendi already touched on that, was the grassroots U equals U movement, the undetectable equals untransmittable campaign, which is an effort by led by people living in HIV to spread the science that people who are living with HIV on effective treatment cannot pass on HIV sexually to others. And campaigns like that are very grassroots, and they yet have gained so much support. And I see that it is so heartfelt when I learned from Fendi that he has been able to do that in the community and changing people's misconceptions around HIV. So yeah, those are really huge moments for me. I just want to say, as I went back to school, I have kind of taken a backseat at OPA because I was formally coordinating the network, but I also want to just to do a quick shout out to Kenneth, who has graciously taken on the role to organize events for OPA this past year, and to all the advisory committee members and volunteers who put in their time to plan and organize for the events for OPA. So yeah, these are things that really, inspire me and just make me want to stay engaged in the community.
Thank you, Christian. And Nancy, so what inspires you? And also, how can we strengthen our community?
I mean, the ACAS is fearless. They really advertise, and then they try to include other people too. So that's that really inspired me, because I'm scared the fact that I have a HIV, and then yeah, I'm scared so many things, like what if everybody know that I'm HIV, and then they don't want to be with me, and then that kind of things is scary. But ACAS is like fearless. They advertise it a lot about HIV, and then they educate people. That kind of thing is inspiring me, and like yeah, and then it's like a family. We become like a family.
So how can we strengthen our community?
I
What do
mean,
you think?
we should. Yeah, we should. There are a lot of people who has HIV, but they don't know about it. And then I think I saw that the brochure saying that you should check it out, your status, and then that kind of thing is important. I think. So if we find that kind of people, we included that more people, and our community will get bigger, and then it's a good thing, because we can stop the spread of virus also. Yeah.
All right, thank you, Nancy. Fendi, so your turn.
Yeah, inspired for me. I wanna say from us to us. So I wanna go standing back to my community who helping me in the beginning in here, because like Nancy mentioned about family, ACAS for me like family number one in here, because I don't have a real family in here. And then ACAS helping me a lot. And then for the strength my community, like the ACAS, I tried for the go deep, for the support any program in the ACAS. Like because I come here like a immigrant worker, then I tried for the join to training, and then I go to the Niagara Falls for the get the training with ACAS staff, and then like another program I running for the fundraising money too. I running marathon, only 5K, yeah. And then I tried for because I joined another committee too, like ASAP. I tried for the open who am I, and then write like join in the story for the make a book, and then for the people know. Yeah, try for the disclosure. Yeah, I tried join in the CAT. I joined workshop, training, PLGA, and resilient. Many program I tried to join. Yeah, maybe in the beginning, anything training or workshop I got for myself in the beginning, I application to myself, and then after I share to who beside me, my friend close with me for the share, because not many people have opportunity for the join the training. And then in the CAT, I joined for the a small community group for the sharing. Yeah, after I joined over there, many people, doesn't matter they living from in Canada long time ago, but they don't have the information. And then I so happy, because in the beginning I allowed the problem, then I learned my problem that I share to my peer, and then yeah, it's helpful for them. I so proud living in Canada with the citizen with my status now. Thank you.
Thank you, Fendi. So Christian, anything to add regarding strengthening the community?
Me, yeah. So earlier on I talked about OPA, and OPA is really volunteer driven, and I think that's the beauty about ways how we can strengthen the community. Just pursue something that you're passionate about, something that inspires you, something that you're interested in. I think a lot of times we need to, as people living in HIV, we need to make ourselves feel good. We need to take care of ourselves, right? But aside from that, we, you know, at least for me, I know I exist today and I'm in good health is because I've benefited from, you know, the love and support I receive from my peers. So that's why when I get to engage in, you know, events like these, or be in spaces like ACAS or OPA, I feel so inspired. It really kind of energizes and recharges me. So, but yet, a lot of these work, you know, requires, I guess what I'm trying to say is sometimes the work does not just happen on its own. It requires kind of like a village to create a sense of community. So if you have time, you know, I know OPA can definitely, you know, benefit from your volunteer time. So if anyone's interested, I guess, you know, just let one of us know, you know, you can let me know, or Kenneth know, or Alex, and we'll see what we can plan in terms of creating more events for the community.
Thanks for the question. Now, so we have a great community. Unfortunately, this year, we are affected by this COVID-19 pandemic. So each of you, can you say something about how this pandemic has affected our community? And let's go, Fendi first.
Okay, thank you. The first time for the answer. Yeah, this pandemic is very trouble for all the community. I can say like that. But for I know the community different chance, but only about the service, because have the protocol from the government for the follow. Yeah, like me in the beginning very difficult because my personality, I like touch people, I like a greeting, I like hug people, I like kissing people. Direct, more interactive. Than the pandemic, very difficult, like the people more far from me now. Yeah, like now very difficult again about the community, how to the service. They always like a virtual Zoom. Like me in the beginning, I very don't like, because too much work for me. I like say like that, and then yeah, no choice for us, because we can accept now if COVID living together with us right now. But still, if I go outside, I still wear the mask, and then wash your hand, and then social distancing. Sorry, because like make crazy, too much crazy about the mental, like this moment. But I tried for the reduce myself. How to if I in the home not make bored. I tried for the decoration like this. I tried for the make happy myself. Yeah, it's work. And then I still join to my community for the support people. Like in the PWA, I still join working over there, but still have the rule how to pandemic. Thank you for the PWA for the still give opportunity for me join. And then for my persona, I try for the go to the street for the give food from my own, and then I give a mask to the people in the street, and then I say wearing this, if the people can respect to you, and then give you some chance or food if you wear the mask. And then yeah, they say thank you. Yeah, I'm so happy. Doesn't matter. I only give a little food what I have, because I know rich, but I reach my heart. No rich about the money, but I reach my heart, and then I try for the share what I have to helping people in the street. Yeah, it's pandemic. Thank you.
Thank you, Fendi. So next, Nancy.
Oh yeah, I mean, this pandemic stops everything, and then all the workshop. There's no more workshop, no dinner, no friends, no conversation, and just being at home is so bored. And then I don't know. And then there's hate crimes out there that's unheard of, you know, things going on in the world. So I'm really unhappy about this the past year and past 1 year. And I wish we get the vaccine and the pandemic is over soon. Yeah. I really miss the workshop and going to the beach in the summer, or even in the winter go to some, yeah, go yeah, go to retreat. I really miss it, and there's nothing you can do really right now. Just waiting for the vaccine arrive soon. I don't know. You know, all the cafe I used to go, they're closed, and so it's like mind-boggling. Like,
Okay, but the vaccine is coming soon, right? And like Fendi said, like you can see something more positive.
yeah.
So what about you, Christian? So how does this pandemic affect your community?
The pandemic. Well, first of all, COVID has been really bad for my hair because I tried to trim it myself the other day, and now I'm bald. So partly, I'm wearing this lovely pink bandana in honor of ACAS, but I'm also hiding my bald head. Anyway, but I think Fendi and Nancy already touched on some of the points. COVID has been quite alienating to people because of the social distancing measures. Yet, and you know, of course, it has impacted the mental wellness of many people, mine included. But yet, in some ways, I feel it has also brought people back closer to one another in some strange ways, and it has forced us to really re-examine what's important to us. So, Nancy kind of mentioned she misses the workshops and the events, and I miss them too. I was very grateful when OPA actually had an event and invited me to kind of speak about harm reduction, because that was something that I definitely have the living experience to share. And it was during an opioid crisis that's happening in Canada. That's something very important for our community to know. If you're using drugs, how can you use safely? So, and other events such as when ACAS actually offered lunches for service users. That was when it was safe for service users to visit the office. That was so lovely. I think it just like warms my heart. So I think in terms of the pandemic, sometimes as someone, I don't really like talking a lot on the phone, but it has kind of made me actually pick up the phone and talk to someone. It has this strange effect. So kind of going old school, sending snail mail or a card to people. And I think what I've learned is, given the constraints that we live in today, how can we actually take care of ourselves, but yet also show loving kindness to others? Because you never know, just being nice and saying hello to someone, you can definitely totally brighten someone else's day. So and lastly, I know I think Fanti and Nancy touched on this already, but in terms of the vaccine, I think for some, there's some vaccine hesitancy going on in the community. And I would just encourage, when the vaccine is here, do, go get it, because it's going to protect your health and also the health of others. So, and we all deserve to live healthily.
Great, thanks. So I guess it's all the questions that we have for tonight, and thank you our three great panelists for their answers. Now, so to the panelists today, do you have anything more you wish to share with us tonight? We have a few minutes here, so wouldn't be that long. So, Christian?
Oh, okay, me again. So thank you, Ben, for being the MC tonight. As I was hearing your a bio, I thought there's a lot of things that you and I had in common, and I really appreciate just knowing you through ACAS, and really appreciate you helping us out with this event tonight. So.
Okay, thank you.
And I also just want to thank everyone for taking time to join us on a Wednesday evening. It's such a great turnout, 28 people. That's pretty amazing. Thank you.
Thank you. What about you, Nancy? Anything to add?
No, I mean, I just wish everybody for the patient for the vaccine, and it's coming. So we will all become, everything going to be normal again. And then we should be patient just a little bit, just a little more time. It's gonna be, yeah.
Fendi, last word?
Okay, I just want to say thank you for having me tonight, and then thank you for the audience. And then I want to add one more thing. COVID is responsibility for us, not only for government. So we teamwork now. Thank you.
Thank you. So maybe in this, the next minute or so, anyone have any questions to our panelists? You can just unmute and ask. Okay, so from Ken to Christian.
Yes, Ken, what's your question? The group OPA you had mentioned, where can I find more info? Ken, yeah, there is actually a website. I need to look up the URL. But I think the person you should contact, I'm sorry, Kenneth, I know you have been coordinating OPEC this year, so I'm going to refer Ken to you, or you can also contact Alex. The website actually needs some updating. It's a beautiful website that was created by one of our advisory members in the past. I think they might be online right now, so hi. And but it also needs updating. So please, contact Ken and Alex. And in the meantime, I'm going to look up the OPA website, and I'm going to put it in the chat link. I hope that answers your question.
Thank you. Any more questions? So Lee,
yes,
just unmute. Yeah, please go ahead.
Hi. So I think my question is directed more at Christian regarding U equals U and PrEP. Now, I know the whole campaign around that was to curb stigma. I'm just curious if the U equals U campaign has helped the positive Asian community in any way to curb the stigma, or do you think culturally we need to do something a little bit more to help people, especially when they're coming out about their sexual orientation and status within the community?
Thanks, Lee. I am going to maybe answer the question very quickly, but maybe I'll also defer the question to also Fendi and Nancy, because I think, you know, they may have some ideas as well. I was engaged with the U equals U movement around 2016 when the movement just came out, and it was still pretty new. And at that time, there was a lot of like, community had a lot of questions, and even, you know, like some global international HIV organizations weren't necessarily embracing U equals U, because I think the logic behind U equals U was so different from what people actually have known about, you know, have been taught about HIV for so long. So the idea that, you know, you can be HIV positive and, you know, somehow you take, you know, HIV medication and not be able to transmit HIV to someone sexually was just so mind-boggling for people. And I think the experience of, you know, us raising awareness on U equals U to the Asian community here was similar in some sense. And it was also similar that there was a bit of a hesitancy or resistance to embrace the science initially amongst the Asian community, as well as also the racialized community. But through time and through community mobilization efforts, and, you know, the broader community actually coming together, and more of the people living in HIV actually coming out and speaking and embracing U equals U, I think that really, you know, helped people embrace the notion. So it's sort of like combating HIV stigma. You know, if you don't challenge it, and if, you know, people always hide away from HIV and no one's speaking on the topic, it's a very difficult thing to challenge HIV stigma. For U equals U, I think, you know, just having folks who are able to become ambassadors, like, you know, Fendi said, he actually, you know, talks about U equals U online, you know, and that's a very brave thing to do. So, you know, the more we do that, the more people would know about it. And I think that's the way to actually promote the messaging and help broaden, you know, this really important science to others. I don't know if Fendi or Nancy, whether you have any, you know, thing you know, your thoughts on U equals U. How has it been, you know, I guess, been embraced by community members?
Yeah, and people still tell me that they are afraid if I said I'm positive. So, so someone told me not to say anything. But I don't know. If I'm gonna have a relationship, I have to tell him. So it's a bit of a challenge. I don't know. If I tell them, they don't wanna be with me still. So I mean, we need to advocate more, and they'll understand. I don't know. They just afraid still. They just still not gonna be my date. Yeah. I mean, I think it's pretty new. The U equal U is pretty new. So I think it takes time for people to understand. But I don't feel limited in terms of doing something, because I know that I'm not transmittable. So, and then the law has changed 2 years ago, that if I'm undetectable over 6 months, I don't have to tell the partner that I'm HIV positive. So that's all I can think of it. When somebody asks me or something, I say no, but I don't know. I mean, I don't know if somebody who's negative will accept U equal U right away or something. It's,
Yeah, but it's kind of broad, right? Because like some people are pretty new to HIV, and then like, we have a lot of
everybody's,
people.
yeah.
So I guess it takes time. So Fandy, anything to add to the Lay's question?
Yeah, I think Sam, all that like a Christian and Nancy say. For me, I still doing if I online on Grinder or any website. If the people say negative and then I say positive, and then they asking how to I sex with you, he say like that, and then I try for the tell them about U equal U. Doesn't matter. I only one person. I teach them because they knew, but because information mouth to mouth very easy. Maybe he can talk with another people if they meet the another people because he knew. Because for me, not many people know about U equal U. Doesn't matter. They is very online, but yeah, I always mention if they wanna hook up with me, and then I disclose her, and then I say blah blah blah. Yeah, but until now, they always acceptive with my condition, and then I have hook up. So, but I still teach them.
Okay, thanks, Fandy.
Yeah.
Yeah, if I can just maybe jump in and just add one thing. So, you know, because we know the scientific evidence actually says if you are U equals U, like you're HIV positive and your viral load is suppressed, there is no way that you can transmit HIV sexually. So that's actually you can tell the person it's actually safer for you to have sex with someone who is HIV positive, who is virally suppressed, than having sex with someone who is doesn't know their status. Because if someone doesn't know their status, there's a chance that the other person actually may have HIV. So actually there's actually some pretty good answers that we can counter when people are hesitant to embrace the science.
Thanks, Christian. So let me just add something, right? So we have the gay issue, and then we have the HIV issue, and HIV brought a lot of like criminalization, dating issue, sex issue. So like, and also we have the cultural issue. So each one is actually like a layer. So we dealt with the gay issue like 20, 30, 50 years ago, and then came to the HIV maybe 20 years later. So it's like coming out and then coming out again. Now we have another hurdle about the viral load, and now we have the U equal U. So I guess it helps in terms of our social life. So I'm seeing it's actually like another third coming out, and also I mean like the cultural issue is always there, but we have to actually like look into each one in our community, like say the Asian community, the gay issue, the being gay is a cultural no, and then we added the HIV thing, and then now the U equal U might help, but I think it would help, but it's still like it takes time to solve all our cultural differences. But yeah, this is what I'm going to say. So any more questions?
There's one last question. I think we have time for one more. And I think it's from Raymond, and it's for Nancy. So you mentioned about encouraging testing. Where or what do you think is the challenge as to why we still have folks not getting tested? How can we encourage them more? So maybe a quick answer, because I know we are running out of time.
Advertising. I don't know. The brochure, we have to give it out. I don't know. Christian, what do you think?
Nancy, I think the quick answer is, well, Canada actually has approved the home testing kit. I think as racialized community member, you know, I think my priority has always been around health equity. And I know a lot of times people are not able to, you know, like pay for the cost of home testing kits. And, you know, there's a lot of discussion in the community that they're working towards ensuring that community members who need the home testing kit can get it. I think what we need to ensure as Asian community is that we need to demand and advocate that, you know, that is going to take place. And I think ACAS has been working with, you know, partner organizations to ensure that it happens. But I think, you know, if people actually hear that, you know, from us, that this is our demand, you know, we cannot be left out. I think that's what can ensure that, you know, Asians can get access to these, you know, very important novel technologies.
Okay, so thank you very much, Christian. So here's for tonight, and thank you very much for everyone joining. So keep an eye on our next community forum, and which is not known yet, but Alex would have an update, or Kenneth would have an update to everyone. So thank you very much for joining, and have a good night.
Thank you for coming. So nice.
Thank you.
Thank you. Good night.
Good night.
Thank you.
Good night.